the young Hamilton dental surgeon determined to make a difference in the lives of children in the country of her birth, which is Iraq. Aseel Russell moved to New Zealand from Iraq with her parents at the age of 5. Her parents took her back for a visit when she was a child in 2000, and when the country was still under the rule of Saddam Hussein. At the same time, it was a country that had infrastructure, including a working healthcare system. But as Aseel tells us, the war in 2003 changed that. Aseel had heard about the damage to Iraq and the lack of health and dental care for children across the country, and took it upon herself at the age of 21 to set up a medical and dental charity to help the children of Iraq. With the help of her parents, both health professionals, and volunteers in Iraq, she set up iCare, Iraqi Children's Aid and Repair Endeavour. The charity runs small community-level projects using volunteers to provide dental and medical services where they are most needed and least available. I asked Aseel Russell about the large amount of work that must have gone into setting up this charity.
Yeah, you're absolutely right. It is a huge mission. It's sort of been an ongoing project for over 5 years, and it's just a matter of getting a lot of people together who specialise in different areas, put in their skills, and we finally sort of got registered and everything, and now it's all up and running, yeah.
People notice your age inevitably. You're still in your early 20s, and what has been involved in you doing something like this at a pretty young age, and obviously with a busy professional career going on as well.
Yeah, so obviously I am a bit younger, and I think that does have its advantages though, because we're sort of the generation of social media and networking, and that's made things a heck of a lot easier, and it's just a matter of finding time, so my weekends are sort of taken up by this sort of thing as well, yeah.
What is the basis of the charity and what it does?
So the charity is called iCare, which stands for Iraqi Children's Aid and Repair Endeavour, and it's basically a medical and dental charity for children, orphans and disadvantaged kids in Iraq, and we do lots of different projects, but pretty much it's funding treatment and life-saving surgeries for children over there, yeah. Straight
away you're starting to see the challenge of it, because that is obviously quite an extensive network of people that you're having to pull together. How does it work?
Absolutely, it is. So it's quite challenging, but, you know, thank God for the internet, because it makes things a lot easier when you're dealing with people overseas. And we just have teams, and basically it's each group of people doing specialised things in their area, and then we all come together for meetings and things like that and discuss how we can improve things and where we can go to next, yeah.
We're providing what kind of range of services, dental and medical services, and specifically what kind of needs are there that are being met through the charity?
It's a huge range. So how iCare works is it's micro projects. So we've got a team that identify children who are in need and they require either dental or medical treatment, and then we sort of do a background, and we have a registration process on the children to see that they are unable to fund it themselves privately or through the public health sector that's involved there. And then we see all sorts of things. So it's things from basic sort of dental abscesses to all the way to brain tumours and things like that. So, yeah.
How on earth do you get specialists in brain tumours part of this operation that you're running from New Zealand? Again, that's the power of the networking, right?
It is. So we have an extensive range of doctors, surgeons, dentists, all sorts of health professionals, and then there's also other people from different areas, so teachers, things like that do help with the other projects. But we do have a range of networks, and it's all about people from different walks of life coming together and saying, okay, I can help with this case, I can help here. And when the treatment isn't available in Iraq, which is more often than not because of the huge brain drain that's happened in the country from the years of war, what we do is we try to get the child the care that they need outside of the country. So that's also networking with people overseas and things like that. And we've had a couple of cases where that's been the case, and we've it takes time, but we managed to sort of fund them to go abroad to have the treatment done.
How have you got over barriers in getting this up and running? I know that you're networking with a similar charity in Iraq, that you're cooperating with an Iraq-based charity to make this happen. But how have you dealt with just basic complications like language differences?
Basically, yeah, like there's a lot of barriers. So language is one, and then trust and making sure that you're dealing with the right people, because there's a lot of corruption in the country in recent years. But how we get over it is just takes time and patience and perseverance. So we've got lots of people who are Arab speaking as well. So the language in Iraq is Arabic, so it helps that we've got people on board that can do that. And we've also got a translation team. So that's a group dedicated just to translating documents. So if medical records come in Arabic, obviously in order for us to show it to our medical staff here in New Zealand who are English speaking, we've got to have people competent in translating. Other barriers like culture and things like that. I think when you've got the same goal in mind, people sort of come together and they overlook those sort of things, so you get over it and you just put your heads down and get to work. Yeah,
it's a very diverse country in ethnic and religious background, and absolutely no discrimination on those grounds. It doesn't matter what people's religious beliefs or background is, that's available to all.
Yeah, absolutely. So that's one of the biggest problems, I think, in the Middle East at the moment, is the segregation that's happening based on religion or political backgrounds or anything like that. So the beautiful thing about what iCare is doing is that we don't even ask about that sort of thing. So we couldn't care less if the child was Muslim, Christian, Jewish, whatever, if they're from what political background their family is. We don't even ask about that sort of thing. If they are in need and they're unable to afford their treatment, if they're orphaned or disadvantaged in any way, then we put our hands up and say, hey, if we can help, we will. Yeah, so it's pretty good. And we've got people on our team from all walks of life, young, old, and different backgrounds and different countries coming together to make this happen. It's wonderful.
You mentioned that many medical professionals left Iraq during the years of war. And where was that? When did that movement out of the country happen, and in what circumstances?
I think it's been happening for a long time. I think certainly after the latest 2003 war, it's become more extensive. So what happens is that a lot of the medical professionals find that they are targeted over there. So, things like kidnappings and their kids being held for ransom or threats and things like that. Some of them don't eventuate into anything, but people feel that they don't have a future there. So a lot of people have left, and medical professionals, it's much easier for them to leave as working immigrants to other countries. So, and that's also professors and universities and the people that are teaching sort of the future generations have also left. So there's a huge sort of brain drain in the country at the moment. And although they're working very hard to get those professionals back in, I think that definitely the need sort of is outweighing the available services that are there at the moment, and it has become more extensive in recent years. Yeah,
that need is also in part a result of the consequences of war. And how many orphan children in Iraq now?
Well, it's anyone's sort of like the exact amount. There's no register or anything that's been set up, which is so frustrating. But the latest statistics estimate that there are over 5 million. I suspect that there's a lot more, because like when we went over there at the end of last year, we visited some of the orphanages, and there's just more and more children being found sort of every day. And with the continuing violence, like, every day there's something happening, and you might not hear it on the news here, but certainly if you go on the internet or if you watch Arabic news, you'll find that it's every day more orphans are being created as a result of the insurgent attacks and things like that at the moment.
Most of them end up in orphanages, and with what kind of care or support possible there?
The lucky ones, I think, end up in orphanages. There's a lot of children living on the streets. What happens in Iraq at the moment is that when you go there, it's the country is, unless you're in like sort of the green zone or in the main sort of areas where it's all safe, the country's sort of divided up, and on the outskirts of most cities, you've got areas called Itajawas areas, which are like makeshift refugee camps, and that's where sort of displaced people live. And I think a lot of the orphans, they either end up with extended family or relatives, or someone picks them up from the street and they sort of go and live in these areas. So they're not really, the lucky ones get into an orphanage and they get registered, and then people are able to help them and things like that. But a lot of them are not in that sort of environment. Yeah, sadly.
You said you went there, I think, late last year, was it? Or very recently you were there. And
Yeah.
what is it that you and the other medical professionals can do on the ground? Is that when a lot of this work is getting done, or is it done on an ongoing basis? How is the healthcare actually being delivered on the ground?
Yeah, so it is on an ongoing basis. So, obviously, our team, the New Zealand and Australia sort of teams, can't be there all the time. But we do have a medical and dental team there at the moment that are based in Iraq, so they are continually doing that for us. And then when we went, so last year was our first sort of charity mission with a group of doctors going from New Zealand. And when we went there, we did several things. So we set up our prevention program, which was visiting schools and orphanages and doing all sorts of things from education to handing out healthcare products like, toothpaste, toothbrushes, soaps, that sort of thing. And also volunteering our skills, so actually going into the rooms and treating and just basically offering the services that we've been trained to do here. Yeah, but it is an ongoing thing. Luckily that we've got a group of dedicated people working on the ground as well, and they're the ones doing a lot of the hard work.
I think it's primarily run out of Baghdad, yeah, but they'll get off into other areas as required.
Yeah, absolutely. So most of the operations are in the main city. However, we have children registered with us from other rural areas around Iraq. So it's not just in Baghdad, but because most of the hospitals and sort of facilities are in the main city, then that's sort of where it's been based at the moment.
What are the facilities like, and the access to drugs and equipment like elsewhere in the country?
I think everywhere, like, it depends where you go. They are private clinics, so we have to sort of be clear about how it works over there. So they are private clinics, and they are very flash, and a lot of the ones that have been sort of set up after the war. The problem with those is that the people that we are trying to help, they can't have access to those. They either can't afford it, or they're not the type of clientele that sort of practice accepts into their clinics. So there's a bit of that. But the services that are available, it ranges. It depends on where you go, and some of it is quite shocking. Like, there's a lot of things that we take for granted here in New Zealand. Things from, like, when you go to a doctor or a dentist here, you just assume that everything is sterile and everything has been, done properly and things like that. And some of the facilities that we visited, where they were below standard, if you compare it to New Zealand standards, I don't think that they would meet the pass. But that's what they've got to work with, and it's better than nothing.
In your specialty in dentistry, when you set up this program, you were in shock over how little was available.
Yeah, absolutely. So I didn't really know a lot about what was going on over there. And when I was at Varsity, one of our assignments was to do a project on dentistry in another country. So I chose Iraq, and it was only then that I started to sort of realise that how much was lacking, and I was a little bit sort of frustrated and upset about it all. Yeah. And we're not just dealing with simple things. Like, there are cases where things are pretty simple, but there's also a lot of hopeless cases. So Iraq at the moment, I think, has the highest rates of birth deformities in the world, and that's due to the years of war and the depleted uranium weaponry that was used as well during the wars. It's all seeped into the environment, and so you
What, into
get
the food chain?
into everything. Yeah, the food chain, I think the water as well, and it depends on which area you live in, but you are exposed to that. And then if women have been exposed to it when they're pregnant, of course that impairs the normal development of a child, and so you get children that are born with horrific things that things like from horror movies. It's quite disturbing. So in cases like that, we do have a couple of children on our Sponsor a Smile program that have been termed hopeless by lots of professionals there in Iraq, and in these cases we sort of still help them out, but in terms of pain relief and just treat the symptoms as they come.
You mentioned it's two different worlds. There are those who have the wealth or the means to be able to access healthcare, and then there are those who can't. For those, particularly those children who can't, again in your own specialty of dentistry, we're not just talking about cosmetic conditions, are we? How serious are some of the illnesses that they have because of a lack of access to dental care?
Yeah, no, we're not talking about cosmetics at all. In fact, that's the last thing I think that we would be concerned about. But so things like, okay, in New Zealand, so it'd be very rare to see someone with a very bad infection from a thing as simple as a tooth decay. But leave an infection in anywhere in the body for a long time and untreated, that could actually lead to serious abscesses, septicemia, blood poisoning, that sort of thing. And I think it is more often than not, it's more common over there, definitely, and that it comes back to the lack of education and lack of prevention programs that are available in the country. And so, for children who are falling through the cracks of the healthcare system, that's sort of the people that we're trying to target. And even if they are orphans, so from that they've lost their dad, but they've still got their mum, we're also targeting some of the mothers as well to get them educated. Yeah.
But
bad tooth
decay can actually result in death, in mortality, if it's just left to run through poisoning. Absolutely,
yep. So the spread of infection can go to the heart and cause problems there. It can go up to the brain and cause a brain abscess and eventually death, yeah.
What are some of the cases you've seen, individual cases of children that really have moved you, where you've been able to make a huge difference to something that is afflicting a child?
Yeah, so one case that comes to mind, and we've been following this young girl for a few years now, a couple of years, so her name's Tabarak, and when we first met her, she had a parotid gland tumour, and she had other problems, and so she had cancer that had metastasized, and but this tumour was just so huge, it just was completely disfiguring her, and it was unbelievable. It looked like something that was stuck on, or something that it was an artificial thing. You couldn't believe that was this small girl with such a young sort of small face, and she had this big growth coming up. So we were able to, luckily through our connections and the hard work of people over there on the ground, fund parts of her treatment, and she eventually had the tumour removed, and then she underwent chemotherapy. So it was really quite moving that she's now cancer free. She's lost one of her eyes, so it's not ideal. There's lots of things and she was deemed a hopeless case. So now that we've still got her and she's still doing well after 2 years, that's a huge achievement. It might not sound like it's a big thing, but it is quite big for what we're trying to achieve. And last we heard from her is that we're actually trying to get her a prosthesis for the eye that she's lost, and trying to restore some of the vision in her other eye that was impaired because of the treatment. So that just makes a huge difference to her life, and if it's making change on a small scale, I think. Yeah.
Another child, I think, needed some injections, and that would have been fatal without them, yeah?
Yeah, so we recently had a child, and he's doing really badly. He was in hospital, and so our team sent us through a video link, an interview in his medical records, and it was so simple. It was something that was so easily treated. He had an autoimmune disorder, and he just needed to restart his immune system, to kickstart it back up again, and it just required injections that were simply too expensive for his family to fund. So we have an emergency fund over there. We were able to tap into that and got him that treatment that he required, and he's doing much better now. Yeah.
I'm speaking to Aseel Russell. She's a Hamilton dental surgeon who moved to New Zealand from Iraq with her parents when she was just 5 years old, and has now set up this charity, iCare, the Iraqi Children's Aid and Repair Endeavour, which is undertaking medical and dental work with the children in particular of Iraq. You are listening to Radio New Zealand National. The motivation seemed to be then the research that you were doing when you were studying and realising what was happening in your home country. You were there not only as a 5-year-old when your parents moved to New Zealand, but you were there as a slightly older child as well. I think in 2000 you went back. This would have been during the time of Saddam Hussein's rule. What are your memories or your experiences of Iraq before the work you've undertaken now?
So when we went in 2000, things were okay. Like, yes, it was like a dictatorship, but you don't see that and you don't feel that when you're over there. And I don't know if it's because we weren't there for long enough, but, most of our relatives and extended family have been in Iraq, so they're not overseas. But it was fine. Like, you could... education was still going. There was lots of doctors around and hospitals were good. The standards were okay. It wasn't perfect, but it was workable and it was functional, and there was infrastructure in the country at that time. I think that he had to be removed from power, and that everything that has happened had to have happened. But I think there was probably a better way of going about it, to get that change in government. If you compare it, like 2000 when we went, and then again last year, if you compare, I mean, anyone that you ask in Iraq, they would rather have what was there in 2000 than what they've got now.
You were shocked. You were 11 at the time. You went in 2000, but even through an 11-year-old's eyes and then going back as an adult, you were shocked by the change that you witnessed.
Absolutely, yeah. It's completely different now. Like, it's not easy to live there. And having lived in New Zealand pretty much my whole life, and knowing how lucky we are here and what we take for granted every day, and then going over there. So things like electricity cuts are still happening very frequently. So you're relying on generators a lot of the time when the power goes off. Just getting from point A to point B, you can't just jump in your car and just go somewhere. It's horrible. You have to go through so many checkpoints, and a lot of the roads are unsafe, so sometimes you want to go from a safe area to another safe area, but to get there you have to go through an unsafe area with lots of checkpoints and stuff. So a lot of that can be quite scary, but it's amazing. The people have such high spirits still, and I think people adapt and they sort of deal with it, when they shouldn't have to.
Why did your parents, you say many family members are still in Iraq, why did your parents choose to come to New Zealand when you were 5?
Well, it was quite a long while ago, so it was after the Gulf War, and I think they wanted a better future for myself and my brother, and so they came as working people. So they're both health professionals, and so they applied for immigration. They travelled to several countries beforehand, and then they heard about New Zealand, came here for a holiday, loved it so much, and decided to move here. So I think we're very lucky that. And I'm very grateful to them that they actually did that, because now we can actually make some sort of difference back home. Whereas I think if we'd stayed there, I'm not sure if I would have been able to achieve, or iCare would have eventuated had I stayed there. Yeah.
Your dad's an oral surgeon. Your mum's a GP. You graduated last year, I think, as a dentist. So you've I don't know how long the course is, but you've achieved a lot in a very short career so far, haven't you?
Yeah, so the course is 5 years, and Dunedin's a wonderful place, and that's we have a lot of support, and a lot of students are involved with the charity as well. So it's not just me. I mean, I might be the sort of the voice of it today, or the face of it in some cases, but there's a huge team of people who have come together to make this happen, and it does get frustrating at times. It gets you get sort of it does get frustrating, and you don't know if you're always doing the right thing or making the right choices. But at the end of the day, it's worthwhile putting in the effort.
It is micro projects that you do.
Yeah.
What is hardest? It must be overwhelming sometimes to see the need, and you've seen it with your own eyes, as you see, and know that you can't do everything for everyone. Yeah. So is that what is hard, making decisions about who can have what?
Yeah, I think that's one of the hardest things when you're dealing with health, and when for a medical and dental charity, there are some of the children's cases, they're treatable, but they're very, very expensive if the treatment's not available in Iraq. So we're often faced with the question of, do you help sort of one child and, use up all the funds that are available for that particular project on this one child, or do you sort of divide the fund and help different children with different problems? It's sort of something that comes about, but I think we have a really good balance in that we haven't had anyone on our program that we haven't been able to help yet, and I hope that stays that way. A lot of the cases that were deemed hopeless by many professionals, we said no, we think we can do something here, and we've taken it on board anyway, and the results were quite good. So yeah, you just have to sort of look at the light at the end of the tunnel in a way and just go through it all and at the end hope that it works out. Yeah.
What do you see in your future? You're obviously just launching your own professional career here in New Zealand, but is this something that is going to get bigger? Do you find yourself having a real sort of being drawn to the country of your birth and perhaps seeing a bigger role there, or not?
Absolutely. I think that I certainly want to stay in New Zealand for as long as I can, and I don't see myself necessarily going back there, because I feel like we can achieve so much from being here, and the whole Kiwiana sort of culture of do it yourself and anything is possible, and that's what it started all off. I think if I'd been anywhere else in the world, I don't know if iCare would have come about and has been as successful as it has been, and it is going to get bigger. I mean, we're already launching it in Australia, so we've got a team of professionals and other people in Australia launching it there. The Iraq team is very solid now. All the foundations have been laid down and they're doing lots of work, amazing work over there. And we're hoping to set up in the US as well. We've had a lot of interest, people just through our website coming through and just saying, hey, I'm in this country, what can I do, what can we do here? There's a group of people, so it is getting bigger and bigger, and we've about to launch our Apple application, so we're keeping up with technology, and so I think that being in New Zealand definitely has helped a lot in getting this all up and running and bringing everyone together.
Aseel Russell. And if you want to learn more about the work that this Hamilton dental surgeon is involved with in Iraq, we'll get a link up on the website to that organisation, iCare. It is ICARE, Iraqi Children's Aid and Repair Endeavour. We'll get a link up on our website, radionz.co.nz/9 to noon.